So today's talk is entitled What You Need to Do and What You Need to Know About Stroke. And our goal here today is to stay really practical and really basic, and then give you just some key information about what you really need to know about stroke and prevention of stroke. Okay? So again, in more detail, our objectives today is we're going to talk a little bit about stroke facts and basics. What are your risk factors for stroke? And what symptoms you should know to recognize if you are having a stroke or if someone you know is having a stroke, how the diagnosis is made, as well as what is the actual data that's out there to support the different kinds of treatment for stroke, specifically surgery or the newer method of stenting. And then I just want to send you home with a few really key and important messages, and then also give you time to ask questions. So as you know, the human brain is one of the most complex organs or complex things that it actually exists. The brain controls your entire body function, your movements, your balance, your speech, your thoughts, your feelings. And so it actually is the central computer or the electrical hub of your entire body. And so you can see why it's so important to have good circulation to your brain. Remember that everything in our bodies need oxygen and circulation in order to survive. If you don't, that body part dies. So another curious thing about our wiring is, as you can see from this diagram, the right side of your brain controls the left side of your body. The left side of your brain controls the right side of your body. That's just the way we're wired. For the most part, you're pretty symmetrical in terms of your body movements. However, there are some things that are more on one side of the brain than the other. For example, language tends to be more affected by the left side, or the language centers are on the left side of your brain. Okay, but you should know that if your brain has a stroke on the right side, your symptoms are going to be on the opposite side. And that's a little bit confusing, but a really important fact to know. So just a little bit more basic anatomy. I'm going to try to stay clear here. So the main circulation of blood and oxygen to the brain is through the front of your neck, and these are called the carotid arteries. If you ever watch the movies and someone falls down and someone's feeling for a pulse on the neck, that's the carotid artery. The carotid artery is shaped like a Y, and one branch goes to your face and to your neck and all of that. And then the other, more important one for stroke is called the internal carotid artery, and it travels up straight into the brain and into your brain circulation. There are two smaller arteries in the back of your head called the vertebral arteries, and all of these four vessels communicate with each other in a circle called the circle of Willis, but we don't need that detail. Again, if you look at this top diagram labeled B, here's the common carotid arteries. And then the external branches off to the face, and again, the internal is the one that the Y branch that goes into your brain. This is a very common place where it splits for plaque to build up. And in this lower diagram, you can see this yellowish plaque building up, and that's the most common place for this plaque to build up. And the reason for that is that Y, that split, causes turbulent flow, and so just like an eddy current in a river, you build up plaque in that area. So plaque is made up of cholesterol, fat, and things like that. This is another picture, a different way of looking. That one was sort of an artist's drawing. This is an actual angiogram where dye is injected into the artery in order to take an active X-ray. And here again, you see this Y-shaped artery. Here's the common carotid artery, the external carotid artery going to the face, and you can always tell because it's got all the branches, and then this other one, the internal carotid artery going straight up and into the brain. So there are two types of stroke, and we're really going to focus on the one you see here on the left side, ischemic stroke. And it's the most common kind of stroke. So 85% are ischemic strokes, and that just means a blockage in the artery which causes lack of oxygen to the brain tissue. And so that can happen either by blockage at the carotid artery or by a piece of plaque or a clot flying off and up into the brain. Either way, the blockage of those blood vessels downstream causes the lack of circulation and that brain tissue to die. The hemorrhagic stroke is more if you have an aneurysm that bursts or something like that. But again, we're going to maintain our focus on the ischemic stroke because that's the one that has to do with what we're talking about today. So, stroke facts. Third leading cause of death in the United States. So it's a major, major deal. It's the leading cause of disability in the United States. And that's the tragedy of a stroke, is that it is very disabling sometimes. It depends on how serious or how big the area of brain that was affected. 60% of people that have a stroke have long-term disabilities or some residual trouble with full functioning after a stroke. About 15% require institutionalized care, and about 30% need some assistance to some degree after having a stroke. So it can be somewhat disabling. There are about 700,000 strokes per year in the United States and 150,000 deaths. So who's at risk? People over age 65, people who live in the southeastern United States, probably somewhat due to genetic factors as well as with the diet in the South. African Americans are more prone to stroke. And then people with the regular risk factors that you think of for heart attacks. So that means high blood pressure, high cholesterol, smoking, and diabetes. So those are the big four. If you've got those risk factors, you're not only at risk for having a heart attack, you're also at risk for having a stroke. Symptoms. We already talked a little bit about the symptoms when we looked at that diagram with which side of your body was affected. Slurred speech is a very common symptom, as well as difficulty with word finding. A lot of times people that have had a stroke, they know what they want to say, but they can't say it. Or the face drooping. So it often looks like the lip is being raised on the other side, but it's actually the face drooping. Weakness on one side of the body or the other. Visual changes, and specifically, people describe their vision changes as a curtain coming down over their vision, as if like a stage curtain was coming down. And that's very typical for a stroke in the back of the eye. Paralysis, loss of balance. Some people actually lean towards one side, which is the side that's becoming weak, and having coordination problems. So I'm going to sort of take a little break here from where we've been going and talk about stroke versus what they call a TIA, or a transient ischemic attack. You might have also heard it called a mini stroke. So the difference between a stroke and a TIA or a mini stroke is simply the duration of your symptoms. So if you have a stroke, that means your symptoms last for more than 24 hours and are staying usually longer than that. TIA means the symptoms are resolving within 24 hours, and the reason for that is usually TIA or a mini stroke is due to a clot traveling downstream. The clot dissolves, your symptoms go away. So that's why it's called a TIA.